So it's my distinct honor and pleasure to introduce our next speaker. And I was driving in here today, I was thinking, wouldn't it be nice if all the specialties of conventional medicine were completely represented with classical homeopathic people? So like if you could just Google, oh, my patient needs a gynecologist who is good at conventional medicine and surgery, but also is a master of classical homeopathy. Wouldn't that be great? Or what about a nephrologist? Or what about a cardiologist? But that's the whole point. We have a lack of certain specialties being represented. So it's my pleasure to introduce our next speaker, Dr. Edward Kondrot, who, of course, is well-versed in conventional training of ophthalmology, both surgical and medical therapeutics. So he knows the great things that we can do in ophthalmology these days in conventional medicine, but he also knows the limitations as well. So he's mastered homeopathy and a whole host of other natural treatments, microcurrent therapy, supplements, dietary modification. And so that's why I'm really interested to see what Ed has to say today. So please let's give him a warm welcome for Dr. Edward Kondrot.
Okay, well, thank you so much. Let's see if I can work these slides. This is my website, healingtheeye.com. And as Bob mentioned, I kind of wear two hats. I'm a board certified ophthalmologist. I've been practicing traditional ophthalmology for 40 years. And my true love is homeopathy. And I've been practicing homeopathy for about 30 years. And my goal is to really help the ophthalmic community and also homeopaths become more interested in treating eye problems. Now, on my website, I have a free download. This is my best-selling book, The 10 Essentials to Save Your Sight. You're welcome to go there, click and download the book. I do have a chapter on homeopathy, but I have 9 other chapters on different modalities, including nutrition, hydration, reducing stress, all of these things to help folks with eye problems. I'm also very active in mission work. I'm currently not doing any surgery in the United States, but I'm very active. In fact, before COVID, my wife and I were going to 2 different countries a month. I recently got back from Angola. We were there for 2 weeks. Helping treat, blind Africans. And unfortunately, they're at such an advanced stage of cataracts. I mean, they're totally blind. And you really can't talk to them about nutrition. Surgery is the only solution to help them restore their lost vision. So I'm getting a lot of pleasure in doing these mission trips. If you do have any questions, always available. I love talking to other homeopaths, helping you with your cases. And please email me at homeopathiceye@gmail.com. And I'd be happy to discuss any case with you. So this is a disclosure. I'm highly biased in using homeopathy to treat eye diseases. Every patient that I see with an eye problem will get a homeopathic remedy. And the main purpose of this presentation is to help bring homeopathy back into ophthalmology. And this is a very important tool that I think can help our patients. Now, I used to say that I'm the only homeopathic ophthalmologist in the world, but I can no longer say that because right now I have a study group. And we have 6 eye doctors, and we get together every Saturday morning from 8 to 9:30 Eastern time. And we discuss eye cases, and it's been really a lot of fun. And I'll give you some information on our meetings later on. You're welcome to join us. I want to begin by talking about the Flexner report in 1910. And I think this unfortunately destroyed our healthcare system as we know it. Andrew Carnegie and Rockefeller got together and they decided that they were going to control the whole healthcare system. And it's interesting, they call it medicine, you know, it should be called health, not medicine. And they hired a guy by the name of Flexner, who was not a physician, not a medical doctor. I think he was a philosopher, and he was trained in the classics. And essentially what they did is they educated him on defining quality of medical education based on some preconceived notions that Carnegie and Rockefeller had. And that essentially began the downfall of homeopathy. I had the real pleasure of looking at all the homeopathic literature that's been published from 1840 up to 1940. And, you know, looking at what the great homeopathic ophthalmologists did in the past. So as you know, drugs are not helping our society. In fact, I think they're destroying our society, and commercials are pushing us to become more dependent on pharmaceuticals. And essentially, we're maintaining disease, we're not curing it. It's interesting when you talk about the practice of medicine. I'm kind of old school, and to me, the practice of medicine was a scientific observation, a case report, and your experience versus knowledge. The practice of medicine should not be based on double-blind, placebo-controlled pharmaceutical studies. This is a really interesting article that was published by Sackett in the British Medical Journal in 1996. And he essentially destroyed evidence-based medicine. I hate it whenever doctors tell me, I practice evidence-based medicine. When they say that, that means to me that they don't know what they're doing, because 23% of highly quoted evidence-based articles will be refuted by later research. And Sackett felt that your clinical experience is the best parameter to determine what would be the best treatment for your patient. So as an ophthalmologist, there are some situations when the patient will need surgery, you know, detached retina or acute angle closure glaucoma. But by and far, I would say 80 to 90% of cases that I see will benefit with homeopathy. And also they have to look at the patient's values. They shouldn't be forced certain treatments or modalities that are against their beliefs. Matthias Desmet, interesting individual who published some articles, and he feels that 85% of all recent medical publications can't be reproduced. That's shocking. I think the whole medical system no longer exists. You know, it's horrible, and I think that, you know, homeopathy definitely is an answer to our problems. So I want to talk about my discovery of homeopathy. I consider myself a very, very good eye surgeon. In fact, I felt that there wasn't any eye problem that could not be corrected by surgery. And here I was featured on the cover of Ophthalmology Times in 1990 for my innovation in cataract surgery. And this is another article here. So I had my own surgical center, a big ophthalmology practice, and I developed severe adult onset asthma, which was destroying my life. I was taking 3 medications, prednisone, theophylline, and a Proventil hair layer. And yeah, you know, the medications were helping my breathing, but one of the side effects was a bad tremor. And you can't be a very good eye surgeon if you have a tremor. And I couldn't understand why I developed asthma. You know, I wasn't a smoker, no family history. So I began to seek out help. And I saw some of the top pulmonary doctors in the country, and they all told me there's no cure for adult onset asthma. Learn to live with it. Make sure you take your medication. But homeopathy saved my life. And I know it wasn't a placebo effect because it was the third homeopathic remedy. It was like a light switch. The first remedy I took didn't do anything. The second remedy may have helped a little bit, but it was nothing remarkable. But that third remedy, oh my goodness, and that convinced me that I had to study this. My first homeopathic lecture, I heard George Vitholkas speak in New York. And at that time, I thought homeopathic doctors were people who weren't smart enough to get into medical school. They learned homeopathy just so they could practice medicine without being a real doctor. And sitting next to me in the lecture room was Dr. Carl Robinson. And as it turned out, we went to the same medical school together in Philadelphia, Hahnemann Medical College. And Carl is an amazing homeopath. And he's the one that convinced me. He said, Ed, you got to study this stuff. You can treat retinal hemorrhages and all that. So I had the unique pleasure of attending the Hahnemann College of Homeopathy. At that time, I was living in Pittsburgh, Pennsylvania, and I traveled all the way to Berkeley, California. That was a long weekend every month for 4 years. And I had some of the, I think, top teachers in the country: Roger Morrison, Bill Gray, Jonathan Shore, Nancy Herrick, Jeff Lester, David Workington, and Deborah Gordon. So it was an amazing experience for me. I just couldn't wait to fly to Berkeley and attend the long weekend of lectures. And I said to myself, I got to incorporate this into my ophthalmology practice. While I was there, Todd Rowe was one of the students in my class, and he invited me to teach at the American Medical College of Homeopathy. So for a while I was teaching there, and I had my practice in Pittsburgh. So I wanted to talk a little bit about, there's a rich history of homeopathic ophthalmology. I was surprised that the New York Ophthalmic Hospital was under homeopathic management. And, all they did was homeopathy. They treated, in 1931, they treated over 31,000 patients. And they offered postgraduate courses in homeopathic ophthalmology. There were 2 journals dealing exclusively with ophthalmology. Well, I shouldn't say exclusively, because at that time, ophthalmology and ENT were combined. But I had the pleasure of getting a hold of all these journals and reading them cover to cover, taking notes and finding out what the great homeopathic ophthalmologists did in the past. And I want to share with you some of that information. And these are some standard works on ophthalmology by homeopaths. A lot of great material here. And these are some of the classics that I always have at my disposal. Right now, what I'm in the process of doing, I'm writing a book, Homeopathic Ophthalmology. And I've been working on this book for about 10 years. It's a study of all the great work that the homeopathic ophthalmologists did in the past, along with some current treatment modalities that I'm doing right now. And I'm hoping that book's going to be available soon. This is a really great book if you wanted to understand homeopathy and the war with conventional medicine and alternative medicine, called Copeland's Cure. Copeland was an ophthalmologist, homeopathic doctor. He was also a senator, and he did a lot in terms of bringing, I think he helped work on getting the homeopathic pharmacopoeia approved by the FDA. And let's see here. And in his book, he talked about the value that homeopathy had in preparation for surgery, the value that homeopathy had to aid postoperative recovery, and also as an alternative to surgery, and also in treating problems that present treatments are not helping. And ophthalmology has come a long way, but unfortunately, there's so many eye problems that traditional medicine and surgery are not helping. And I think in many situations, they're just making it worse. Now, I want to begin this talk by talking about what is vision. And I think as homeopaths, we need to look at the components of vision. There's an energetic component, functional, and structural. Now, the energetic component is kind of interesting because so often, I'll see a patient that does not express any problems. They're able to function, and yet maybe they can barely see the big E on the eye chart. On the other hand, you may see somebody that's able to read the bottom line of the eye chart. They have 20/20 vision by definition, but they have a lot of visual complaints and there's no physical findings. And I think this is something that as homeopaths, that should really perk our ears when we hear something like that. Another interesting idea is that the eye is both a camera and projector. So not only are we absorbing our external environment into our eye is also projecting our reality. And if you think about that, that's kind of amazing. And I like this photograph here. The eyes can express a lot of anger. And there's these interesting photographs here. If you look at this can either be a witch or a beautiful woman. This photograph here, it may appear just like trees, but you can also see the face of a person there. And this can either be a vase or two individuals looking at each other. So this energetic component is kind of subtle. The expression the glass is half full or half empty. And this is where I think a person's description of the visual system can be extremely valuable as a homeopathic doctor. Anytime somebody comes in, my vision's blurred. Well, tell me, what is it like to have blurred vision? Or what is it you wish that you could see? I mean, these are like kind of standard homeopathic questions, but they can kind of get to the root of the problem and help lead us to a remedy. Now, there's also a functional component of vision, and we're all aware of good nutrition, detoxification, alternative treatments such as acupuncture, microcurrent, homeopathy. All of these things can help improve the function of the eye, the metabolic function, in stimulating the visual system, etc. And then we have the structural aspect of vision. Eyeglasses, contact lenses. When somebody has cataract surgery, you're removing a pacified lens, you're giving them vision, you're doing something structurally. So you need to look at vision in terms of those three elements: the energetic, the functional, and structural. Now, I think this very nicely leads into this term here, asthenopia. When I was doing my residency program, studying ophthalmology, we used this term whenever somebody had a visual complaint, but no physical findings. And, it was kind of a wastebasket diagnosis, asthenopia, we would call it, meaning everything's normal, except there's something wrong with the patient. But actually, this is what homeopaths really, really like, because we're looking at symptoms, how they're affecting the person. So I want to talk a little bit more about asthenopia. There's an excellent book by George Clark, The Homeopathic Treatment of Asthenopia. And I thought his book was fascinating. So he quotes the term weak sight covers a vast amount of ignorance on the part of many doctors and a multitude of distressing symptoms in many patients. So much is now known of asthenopia and the parts involved that it is inexcusable and anyone to treat a patient by glibly informing him that his sight is weak. And all is requisite is medicine. In some cases, medicine alone is all that is required, but far the large majority of abnormal refraction plus constitutional tendency are the disturbing factors. And in these medicines and correcting lenses are required. So the approach was, yeah, they may need glasses, but the proper medicine he's referring to is homeopathic. So there's three categories of asthenopia, and one is ciliary strain, and this is commonly called focusing fatigue or accommodative asthenopia. And this is due to the strain of the ciliary muscle, because whenever you're doing reading, your eye muscles are changing focus. And at the same time, your eye muscles are changing focus, your eyes also have to converge or move in. You know, if the eyes are looking straight ahead and the accommodation is changing, you're going to have double vision. So I'm going to talk a little bit more about a big problem called convergence insufficiency, which is a huge problem that's ignored. So one is the ciliary strain. The second is the muscular asthenopia, which is strain of the extrinsic muscles of the eye that move the eye in. So there has to be a coordinated effort between focusing and the muscle movement. And the last one is retinal asthenopia. And this is due to the strain of the retina and its connections, maybe due to excessive light, poor nutrition, etc. A ciliary strain or focusing fatigue, I think is not only important for reading, but according to an optometrist, Dr. Lane, he felt that this could be a trigger of developing an increased intraocular pressure. According to his theory, this accommodative strain can contribute to an elevation of eye pressure and glaucoma. Physostigma is my go-to remedy when treating glaucoma patients when there is no clear constitutional remedy. And I always think of this in glaucoma patients when they have complaints of eye strain. So this is eye asthenopia accommodative. You can see the list of remedies here. Another big remedy is Ruta. You know, Ruta is a homeopathic remedy for the tendons. And there is a tendon insertion with the extraocular muscle. So whenever somebody has this accommodative eye strain when reading, Ruta is the #1 remedy. Muscular asthenopia is due to the strain of the extrinsic muscles of the eye, especially the internal recti. As I mentioned, when you're reading or doing close work, your eyes have to turn in. So the medial rectus or the internal recti are working. So I recently had a patient who had eye strain, poor vision, worse for reading, watery eyes, extreme sensitivity to sunlight. These were all characteristic symptoms of Nap-Muir, and you can see that Nap-Muir is one of the big remedies for muscular asthenopia. And just one dose of Nap-Muir relieved all our symptoms almost immediately. So think of Nap-Muir for the muscular asthenopia. Now there's more to the problem with retinal asthenopia, and this is due to overstimulation of the retina and a glare of the sun, snow blindness, electric light, lightning. Also, when the eye doctor dilates your eyes, that's a problem where light's coming in. And I think this is becoming more and more of a problem in our society because #1, we're spending all our life, you know, on our personal devices, on our computer. And I think that probably about 80% of the population is suffering from some form of asthenopia because they're not using their eyes properly and the overstimulation of light. Now, there's a very interesting syndrome called light at night syndrome. And, you know, our circadian rhythm is really, really important. And I tell patients we need blue light during the day and we have to avoid blue light at night. I tell my patients, you know, God made the sky blue and the ocean blue, that when that sun sets, the red spectrum comes in. And so right now, we're having too much exposure to blue light at night. Professor Abraham Hayam has done some research to show that excessive blue light at night is a major contributing factor to a lot of health issues, diabetes, obesity, certain types of cancer, and I believe macular degeneration. And one of the culprits is that, you know, our government is forcing us to use fluorescent lights at night. And we're doing away with the incandescent lights. The incandescent lights have a red spectrum, which we need at night. So I think it's really important to avoid blue light at night. And it's kind of remarkable. I have an iPhone, and there's something called a night shift in the iPhone. During the day, it has a blue spectrum, but at night, it changes to a red spectrum. And I have an RF meter, which measures the harmful electromagnetic frequencies. And I'll tell you what, you hold this meter up to a incandescent light. It's very, very quiet. But you hold it up to a fluorescent light, and it's crackling so loud. And it's like, you know, our brain is getting these harmful electromagnetic frequencies that are really harming us. So from acinopia, let's move to amblyopia. Amblyopia is an interesting term, and I think you really have to be familiar with it. Amblyopia means that there's a loss of vision with no physical pathology. And there's three types of amblyopia in conventional Western ophthalmology, and then I'll talk about what the homeopathic literature had. One is anisometropia, and this just simply means if there's a difference in your spectacle correction. So let's say a baby is myopic in one eye and hyperopic in the other eye. The eyes look perfectly normal, but during the development of that child, they're going to be using the nearsighted eye more and not the farsighted eye. And because of that, the eye is going to develop amblyopia or loss of vision. The eye looks normal, but it just can't be corrected. Also, a strabismus. If the eyes are turned in or turned out, the brain has to shut off one eye, and that eye will become amblyopic. No pathology will be observed, but it just can't be corrected to 20/20 vision. And the other one is some type of deprivation. For example, if a child is born with a droopy eyelid or a congenital cataract, the brain is not going to be stimulated, and that will be developed amblyopia. Now, amblyopia in the homeopathic literature, alcohol or tobacco abuse, trauma, congenital, and suppressed eruptions, suppressed menses, aggravated during pregnancy, and related to rheumatism. So one thing I always look for is suppression. And I think suppression is becoming more and more common in ophthalmology. I believe that the act of cataract surgery can cause suppression. There's been some studies to show that there's a higher incidence of macular degeneration after cataract surgery. And I think that you have to look at suppression, because if the body has a higher sense of wisdom and the organism is developing a cataract for some reason to maintain homeostasis based on homeopathic philosophy, and you're removing that cataract without looking at the underlying cause, it's a form of suppression. So you would expect another issue to develop, a deeper pathology like macular degeneration. Another big problem we have is, and this all ties in with the asthenopia that I talked about, is the computer vision syndrome. And it's the modern day version of all the asthenopias. And this is a group of symptoms that develop in people using computers or other digital devices. And I think about 90% of all computer users who spend more than 3 hours a day in front of their computer suffer from computer vision syndrome. Not only your computer, but your iPhone, all your personal devices. And it probably is affecting over 60 million people around the world. And symptoms include eye irritation, blurry vision, headaches, among other things. And this is an opportunity for the homeopath to work with the eye doctor in treating this condition. And I would like more of you as homeopaths to work with the eye doctor. And I think that the first step is they need proper spectacles, proper glasses to reduce eye strain. And second, consider a tinted lens to reduce light toxicity. For example, if you're doing a lot of computer work at night, you probably want to have a blue blocker. And you can get a blue blocker lens at any drugstore. It's an amber lens that a lot of people use them. They're shooting glasses too. And third, select the correct remedy, which matches the patient's symptom. So these are some of the 3 top remedies for treating computer vision syndrome. Natrium muriaticum, that tends to have more light sensitivity and watering of the eyes. Ruta graveolens is the top remedy when there's more stiffness in the eye with fatigue. And physostigma, more difficulty focusing up close, and also twitching of the eyes and sometimes flashing of light. So they're my top 3 remedies. Another condition, convergence insufficiently. And I think this is probably the most common and misunderstood visual interference to acts of daily living that our society has. And by convergence insufficiency, there's a deficiency of the eyes turning in. Remember, when you are reading or doing close work, 2 things have to happen. You have to change accommodation, changing your focal point with the eye. Your ciliary muscle does that, and the eyes have to move. So there's an imbalance between convergence and focusing. And this can be very troublesome, causing headaches, double vision, blurred vision, and preventing the individual from reading effectively. And it is very, very common in a lot of students, college students, and it's really physically a debilitating condition. It also can develop as a result of an illness or trauma, such as a concussion. I had an interesting, I do some part-time eye exams for the VA, examining vets for disability. And I examined a veteran who was exposed to a Claymore mine explosion. And after that, he had trouble reading, and he went to many, many different eye doctors, and everything was normal on his eye exam. He had perfect vision. I mean, his vision was 20/20. And they were thinking that he had dyslexia, but actually it was convergence insufficiency. I did some tests on him, and his focusing was out of alignment with his eyes converging in. So you can find this in the rubric divergent strabismus in the repertory. And the key remedy is Natrium muriaticum. And this remedy, along with the correct glasses, can work magic. And you can see it's in this rubric, it's bold and underlined. The differential to NATMUR, which characteristically has photophobia, watering, redness, burning, eyes filled bruised, eyelids heavy, muscles weak. Agaricus is also there, but there tends to be more twitching, trembling, and spasms. Camphor is more of a shock, collapse, cold sweat. Cholesynthesis is more of a neuralgic pain in the eye. Conium, worse with artificial lights, paralysis of ocular muscles, and ability to focus on moving objects. But the majority of these people can be helped with natrum muriaticum. Now, I know that all of you, this has been on your mind, and maybe some of you wanted to ask me this. Can you go blind from masturbation? Well, in our repertory, these are the two remedies here that may help: gelsemium and phosphoric acid. And when you think about this, gelsemium is for fatigue, phosphoric acid, fatigue too. So, you know, the sexual act can be debilitating and drain us of our strength. So now let's go into the anatomy of the eye, and we can talk about some specific diseases. So just an overview here of, I don't know if you can see my pointers, but the upper and lower lids, the lashes, and you have your lacrimal gland up here, and you have your nasolacrimal duct. Cross section of the eye, the cornea, the lids, the lens, and the retina. These are two examples of macular degeneration. And I'm going to be talking about macular degeneration in a little bit, but one thing that I think helps me have an advantage, and I kind of got upset with the homeopath I was talking to, and this homeopath said to me, I don't really need to do a physical exam or see the patient's records because I treat them based on symptoms. But I think this is so false, because even Hahnemann would spend an extraordinary long time sometimes examining a patient, you know, listening to their lungs, checking their pulse. I think the physical exam is critical. And I think this is the big advantage that I have as an ophthalmologist. I'm able to actually look at the pathology. So when you look at these two cases of macular degeneration, yeah, the complaint of decreased vision may be there, but when you look inside the eye, you see a different clinical picture. This one has these drusens or warty-like growths. This one has some discoloration. And one thing that I find very helpful is using the skin section. You know, the eye and the skin are derived from the neuroectoderm. And so there is a correlation with the skin. So discoloration, growths, and things like that, you can always find a rubric in the skin section. And here's some examples of scarring, retinal hemorrhage. And one thing that I always insist before, I do a lot of telephone consultations, and I make it mandatory that I get a recent copy of the patient's eye records. Because when they present to me with a decrease in vision, and they give me some historical aspects, maybe there's a causative factor, and maybe there's some other modalities involved, and concomitants, etc. But it's a whole different treatment plan if it's a retinal hemorrhage compared to glaucoma, compared to a cataract. So understanding, you know, the physical pathology is critical in helping to select the right homeopathic remedy. So these are the leading causes of visual loss: macular degeneration, cataracts, diabetic retinopathy, and glaucoma. Cataracts are probably the most common problem that I see, but it's also the most difficult, because you really have to look at the underlying cause, and usually the underlying cause is a nutritional deficiency or heavy metal toxicity. And these are some different types of cataracts. And of course, the appearance of the cataract can help lead you to the right homeopathic remedy. And this is a cataract that's more posterior in the eye. It looks like some fine dust in the back of the eye. This is more of a white nuclear sclerotic cataract, and this is a cortical cataract here. This article was published in 1891 in the North American Journal of Homeopathy. This was a retrospective study of over 295 patients. 100 patients were under treatment for greater than 3 months, and all the patients were seen on a regular basis. 55% success. By success, there was either improvement of vision or no further progression. Improvement in 13% of the cases, no change in 42, slight decrease in 26, significant decrease in 19. And this is time period, I'm going to go over this. But these were the big remedies. The top 3 remedies, causticum was used in 64% of the cases, and the feeling of sand in the eye, sensation of pressure, heaviness in the eyelids, burning, itching, desire to keep the eye open or closed, a photophobia, flashes of light. Talc phos was another big remedy. Headaches on the right side, pain in the right eye, stiffness. Sepia, eye feels weak, worse towards the evening, better in the middle of the day, etc. And I find that sepia is probably the #1 remedy that I use in the treatment of cataracts in women. Phosphorus, the phosphorus patients tend to complain more of colors before the vision, floating spots, and flashes. Anytime a patient has these symptoms and they have a cataract, I'm thinking of phosphorus. And let's see, I'm going to go through this. Now, the really fascinating thing in Norton's article, he stated that the patients that had an improvement of vision, he saw very little change in the pathology of the lens, very little change. And I see that in my practice. I'll treat a cataract patient and they have a significant improvement of vision with homeopathy. And when I examine them, there's very little change in the cataract. And I really feel that, you know, there's such a strong energetic component of our visual system that, you know, we may not see a change in the pathology, but the person has an improvement of vision and, you know, their chief complaints are gone. This is a couple other remedies here. I'm going to go through this here. This is a patient I had, 54-year-old male, double vision in the vertical plane of the left eye, which I thought was kind of an interesting description, how precise and accurate is the main complaint. And, you know, you always think of a mineral whenever a patient has these very accurate descriptions of, you know, vertical double vision in a certain plane. And this was the rubrics that I used, and it was prescribed silica. I like to use the LM potencies. They take them every day. Don't have to worry too much about aggravations or antidoting with other things. Now, glaucoma is another condition that I think really homeopaths can help, because glaucoma, #1, is poorly understood and very difficult to diagnose, and I'll talk about that. Due to an increase in intraocular pressure, which causes damage to the optic nerve, and traditional ophthalmology is just focused on the pressure aspect. You know, how can we reduce the pressure? There's no attention to the health of the optic nerve. And I think this is really where homeopaths or naturopathic doctors can be of big service. What can we do to improve the health of the optic nerve? And of course, everything that you do to improve a person's general health will be valuable in improving the health of the optic nerve. Now, glaucoma is a condition where there's a problem with the aqueous outflow. So the ciliary body here produces aqueous humor, it percolates in the eye, and then it leaves through the trabecular meshwork. And the thought is that because of clotting of the trabecular meshwork, disruption, scarring, blockage, you get an increase in intraocular pressure. So a lot of the surgical procedures that we do with glaucoma are to improve the outflow. The analogy is that, you're filling your bathtub up with water and the drain is blocked. The water is going to start to overflow, so you got to clean the drain. So we do laser procedures, cutting procedures to help lower the pressure. And glaucoma is also called a thief in the night because you slowly lose your vision from the periphery, like this picture here. And sometimes you're not aware of it until it's too late. And the real damage occurs in the optic nerve area here, because that is the weakest area in the eyeball. So the analogy is if you put too much air into basketball, it's going to start to split at one of the seams. And so the seam in the eye is right where the optic nerve enters the eye, and that causes damage to the optic nerve. And you get what we call cupping. This is a normal nerve on the left, the white center area. In glaucoma, you get atrophy of the center area. So in the homeopathic literature, unfortunately, most of the articles in the homeopathic literature have to do with acute glaucoma, which is you develop severe pain and decrease in vision. I think that all of these remedies, gelsemium, boronia, aconite, osmium, phosphorus, belladonna, I think belladonna is my #1 remedy for treatment of acute glaucoma. And but they did cover in the ophthalmic literature that you need to look at the tally of the symptoms, determine the right homeopathic remedy, and not just those related to the eye and vision. Let's see. So these are my big 3 glaucoma remedies. Apis mellifica, especially if they're thirstless. And physostigma is my #1 remedy with a family history of glaucoma, and gladonium if they have an associated history of hypertension. But these are the cases that I'm talking about where there's no clear constitutional remedy, or if the constitutional remedy does not work and you're looking for something else. This is an interesting glaucoma case I had. She said this to me: if you upset me, I'll cut you with a straight razor. 69-year-old lady. And these were the rubrics. She was a very jealous person, mind desire to kill, photophobia. She had diabetes, fear of snakes. It was a classic lachesis case, and lachesis did help her glaucoma. And a lot of times, what do I mean by help? My goal is when I see a glaucoma patient is, one, I want to stop the progression of the glaucoma. I want to reduce their glaucoma medications. In many cases, we can get them off the glaucoma medications. But one thing I'm really strict with, if I do consult somebody with glaucoma, I never ask them to stop their glaucoma medications. Glaucoma is a very serious disease. It's one of the few diseases that can lead to total blindness if it's not treated properly. And this is the repertory on glaucoma. Also, we need to look at the optic nerve. Glaucoma is a condition of elevated pressure, which affects the optic nerve. So you really want to look at, in the repertory, atrophy of the optic nerve and inflammation of the optic nerve, etc. Macular degeneration, leading cause of blindness over the age of 65. And there's some thoughts that it's more common in people that are nearsighted, may be related to excessive ultraviolet light radiation from sunlight. There's some thoughts that blue light may accelerate the cause. But this is the shocking thing that I came across. While reviewing the early ophthalmic literature, no cases of macular degeneration were described. And how can this be? In fact, in the ophthalmic literature, macular degeneration wasn't noted until 1920. Now, the direct ophthalmoscope was developed in 1850 by Helmholtz. So both homeopathic and allopathic ophthalmologists used this instrument to observe macular findings. And in the old ophthalmology books, there were exquisite drawings of detail of the retina. You know, maybe a hemorrhage or a tumor or lesions, arteriosclerosis, etc. That not one case of macular degeneration. And you know, how could this be missed? And Dr. Chris Kenobi, who's an ophthalmologist, felt, and this has been supported by some other research, that in the 1990s, people began using seed oils. Margarine was introduced in Crisco, and he felt that these oils are toxic and poorly metabolized in the body. And the accumulation of these oils is the main cause of macular degeneration. So this is really shocking news that, you know, it should be called diet-related macular degeneration. We need to avoid the seed oils, and you're probably better off consuming butter or lard as an oil. Avoid the seed oils. This is something that when I discovered, it was just shocking. So let's look here. The changes in macular degeneration can be varied. You can get some hemorrhages, hyperpigmentation, drusens, or little growths in the eye. And typically it causes distortion in the central vision. And by looking at an Amsler grid, like you see here, you can get some wavy lines and distortions. I tend to look at macular degeneration and try to tie in the right miasm. That's my first step. The psoric stage, minimal pigmentary changes, psychotic stage, hyperproliferation of tissue, and the syphilitic stage. And this can be very valuable in helping to select the right homeopathic remedy. Now, because macular degeneration wasn't that common in the early homeopathic literature, there isn't a precise rubric for that, but we can see degeneration of the choroid is used. And these are some of the remedies that I have found helpful for retinal atrophy, in particular carbonium sulfuratum. It's one of the few remedies that are listed for a central scotoma, and that's kind of one of my go-to remedies for macular degeneration, because classically you develop that central scotoma. There are also some good tissue salts for macular degeneration. Other remedies, Sakali, Sanicula, Vanadium, and also the SAR code Retina 5C or 30C. You can obtain it. This is a case of macular degeneration, 78-year-old female. Biggest rift has been with my daughter. And these are the rubrics. A lot of anger, indignation, and Staphylos aurea 200C, and she did very well. Another macular degeneration case, cataracts and vertigo. She had the vertigo. She loved ballroom dancing. Sexual desire was diminished. A lot of classic symptoms for sepia. She did very well for sepia. One of the most dramatic cases I had was a case of central retinal artery occlusion. This was a 57-year-old radiologist who developed a sudden loss of vision in his left eye. And he was evaluated at the University Retinal Service. And, you know, I was taught in medical school, when you get a artery occlusion, central artery occlusion, nothing can be done. And he was essentially blind. And I treated him with Bothrops, and he had a dramatic, in fact, total recovery of his vision, which shocked me. I mean, this was not supposed to happen. and he was extremely grateful. And this was a miracle that convinced me that homeopathy can work miracles.
From calendar, Bridge CFK admin, tomorrow at 6 p.m.
Let's see. Let's see here. All right, expect miracles with homeopathy. There is a long history of homeopathy and ophthalmology. And I do have a study group that you're welcome to attend. You can email me at homeopathiceye.com. This is our Facebook study group. You can join us on Facebook. This is the book that I'm putting together. It's probably going to be a 2-volume book, Homeopathic Ophthalmology. I did have a 3-hour presentation at the New York Homeopathic Society on this. And you can go and get the presentation here, homeopathiceyebook.com. You can listen to the presentation. Now, I briefly wanted to, Tim, do I have some time to talk a little bit about microcurrent?
Absolutely. Yes.
Okay. Let me go back here.
It's about 11, so you got a good half hour.
Oh, but I wanted to open it up for questions. I didn't want to.
So, but I mean, yeah, sure.
Okay, anyway, I was kind of surprised, part of my practice is microcurrent. I've been doing microcurrent for about 20 years, and I thought I was unique, but I found out that many of the homeopathic ophthalmologists were routinely using microcurrent. They didn't call it microcurrent, they called it galvanic treatment with their ophthalmic cases. They were using it with their homeopathic remedies. So the galvanic current is a direct current. It's a long duration interrupted direct current of about 100 microseconds. The frequency is about 30 per minute. And but the difference is, I'm using FSM, which is an alternating current. It's a little higher frequency. And the FSM has been studied to show it can reduce inflammation, improve circulation, stimulates mitochondrial activity, and stem cells. And this was one of the early devices that we used. And the frequency specific has to do with getting the frequency of the current to match the frequency of the tissue. And the analogy is that every tissue has a unique frequency, and that's based on the carbon, oxygen, nitrogen bonding, the hydration, and the density, much like 2 different tuning forks. If you have 2 tuning forks and they each have the same note, C sharp, and you vibrate them, they'll be in harmony. So the device we use now is a very low current. I think that it is a nice supplement to the homeopathic treatment in terms of improving the circulation, reducing inflammation, helping regeneration. And this is some of the articles that I found in the old ophthalmic literature that used the treatment of ocular muscles. In affections of ocular muscles, I have found electricity to play a highly important part. And I scarcely know how to get along with it in many cases of insufficiency and incoordination. Earlier, I talked about convergence insufficiency. So microcurrent can really help eliminate the eye strain, and also help in cases of an ocular muscle palsy or a paresis or a weakness. Diseases of the choroid too. They didn't talk specifically about macular degeneration, but it can improve the circulation, reduce inflammation, and improve vision. The big area is retinitis pigmentosa. This is a hereditary condition. I have found that homeopathy can work extremely well with retinitis pigmentosa. These are really unfortunate individuals. There's no good treatment, but the combination of microcurrent and homeopathy can really help improve the vision. It doesn't cure the condition, but it helps improve the peripheral vision, helps improve the acuity, and it can really give these patients a new life. Retinal hemorrhage. Homeopathy works very, very well with retinal hemorrhages, all the snake remedies, but when you combine it with the galvanic current or microcurrent, it can really help in the absorption. Optic nerve disease, and this is a big one. Glaucoma is such a devastating disorder, and traditional ophthalmologists, all they do is they're just focusing on lowering the intraocular pressure. They're not really looking at the end organ that is damaged, and the end organ is the optic nerve. So in addition to homeopathy and other naturopathic measures, like good diet, proper nutrition, detoxification, etc., can be very valuable, and using microcurrent. And these are some cases that were from the American Homeopathic Ophthalmological Society at their 17th annual meeting in Niagara Falls in 1904. This was atrophy of the optic nerve, strychnine phosphorica 6X, and galvanic electricity. The vision of the eye slowly improved up to 10/20, which is good functional vision. Didn't help the one eye, but the one eye did improve. Lachesis combined with galvanic current. This is always yielded in time to remedies and local galvanic electricity in this lady that had these acute hemorrhagic attacks with complete loss of vision. So in my evaluation of ophthalmic disorders, you want to be clear what the problem is. Have the patient define the issue, and typically they're going to say my vision is blurred, but you want to get a more detailed definition. What do you mean by blurred vision? What do things look like? How is it affecting your life? And of course, causative factors and concomitants, other changes in health and modalities, and this will usually lead to a good homeopathic remedy. And I love it because I love it when patients say to me, I don't know what you gave me, Dr. Kondrot, but I've never felt better about it myself. It makes me feel so good that homeopathy, not only helps their vision, but it helps their whole person. Of course, you need to observe Hering's law, mainly because there's so much suppression in our world, in our society. The direction of healing, return of old symptoms and new symptoms to make sure you're on the right track with the homeopathic remedy. As I mentioned, we do have a Facebook study group. If you're interested in joining us. And also some of you may be interested in microcurrent. We also have a method to help you bring microcurrent into your practice. Those of you that are licensed practitioners, you can go to imicrocurrent.com. And this is my mission website. We're always looking for volunteers. My wife and I were not doing as many missions as we did prior to COVID, but we're probably doing about 3 or 4 missions a year. They're really extremely rewarding. You're able to help so many people. So you can get in touch with me if you're interested in joining me on any of the missions. So I really want to be part of your homeopathic society. If you do have any questions about any eye problems, feel free to email me. And what I'd like to do is to open it up for questions.
Um, I have a question, Dr. Kondrot. But first of all, thank you very much for this wonderful presentation. I wish I could just come and hug you for the information you have given and the introduction that you gave.
You
Can
can
you hear
hug me
me?
online.
Yes, I will. Um, so my question is, going back to the topic of asthenopia, uh, you mentioned three types. Can you please tell what are the symptoms and how can we make a clinical diagnosis of
I'm sorry, I don't hear.
uh, going back to asthenopias? What are the presenting symptoms and how can we make the diagnosis, clinical diagnosis?
I'm not hearing.
Um, So I think Amishi was saying about the three types of asthenopia.
Your question.
Yeah, and what was the second part? The three types.
Oh,
of
how do you diagnose them?
and how do you diagnose asthenopia?
Well, asthenopia is just a visual complaint with no clear pathology. And it's a common, it's like a waste basket diagnosis. When you don't know what's going on, you call it asthenopia. But as homeopathic doctors, we're very keen with symptoms. So in my ophthalmology training, someone come in with headaches, light sensitivity, difficulty reading, and we do an eye exam, everything's normal. And we would call it asthenopia. But as a homeopathic doctor, we should be salivating that we may have a remedy for this person that help. So I kind of went over the different categories of asthenopia in terms of, accommodative, muscular, and retinal. But as a practitioner, if if you have the copy of the patient's eye records and there's no findings, then you can label them as asthenopia, but that doesn't mean that there's no help for them. You use their symptoms to guide you to the right homeopathic remedy.
Would it be helpful to choose a remedy based on first trying to categorize the asthenopia as one of the three?
Oh, definitely, definitely. Because there's specific remedies that might be more muscular, like Ruta would be more muscular. Maybe Physostigma might be more accommodative. And then, of course, in the repertory, we have those categories: muscular, accommodative, and retinal.
So then how do we categorize or choose the category based on the symptoms?
Well, you have to evaluate when the person develops their eye symptoms. It could be for prolonged reading. For example, if they have double vision with prolonged reading, that's probably more muscular, because the internal recti are not pulling the eyes in. If it's just eye fatigue or headache or flashes, then that sounds like it's more accommodative.
Okay.
But if you do have a patient, I'd be happy to discuss it with you. One thing I really need is anytime I talk to a practitioner about an eye case, I like to see the eye records. Because I look at with their age, their refraction. The eye doctor usually will measure the extraocular muscle movements and things like that, which will be very helpful. So sometimes it's not just based on symptoms. The symptoms can help lead to a remedy. If you have the right modalities and the right symptoms, it may be a clear picture for a remedy. But I always like to, confirm the remedy selection with the pathology that's there.
Okay. Thank you.
Oh, thank you.
Ed, so we have a comment from Minhaj Khan. He's a member. He's a family doc in Texas. He says, thank you. And Elizabeth Davis has a comment. She says, wonderful, wonderful presentation. She's a chiropractor who practices at the VA in Chicago. She says, wonderful, wonderful presentation. Do you consider vector-borne illness when treating tumor, cysts, eye lesions, or doesn't it matter? Vector-borne illness. I'm thinking maybe like Lyme disease, things like that.
Yeah, that's what I'm thinking of. Well, I believe my homeopathic philosophy is that if the constitution is strong, you're not going to get Candida or Lyme disease. And I think a mistake a lot of people make is they treat the vector and not the person. You know, you hear a patient say, if it wasn't for my Candida, I'd be healthy. I wish I could get rid of it. Well, it's not the Candida. It's your constitutional state. We got to strengthen you. And the Candida will leave or the Lyme will leave. So I think it's a weakened constitutional state. So usually I don't focus that intensely on that when I'm doing, you know, my homeopathic eye evaluation, although it may come up.
And Joel has a question. Joel Shepard.
Joel.
Yes, hi. I think we've referred a patient to you recently. Hope that works out. But the question here is, why doesn't homeopathy do what microcurrent does?
I didn't hear the question.
Why doesn't homeopathy do what microcurrent does? Is that the question?
I think microcurrent works more on the physical level. You know, it actually causes a physiological change in the tissue, maybe increasing mitochondrial activity, increasing blood flow. But the treatments are so different. I mean, my number one treatment is homeopathy. But as you know, as a homeopath, we don't always get the right remedy. And when I have somebody coming to me that's going blind, they may not wait until I try a couple of different remedies. It's nice when you nail the right remedy. So I think that, you know, when you do start the microcurrent, at least that's a, you know, non-invasive treatment that's going to be helping improve the whole visual system. And I kind of got reassurance of this when I was looking at the old homeopathic literature, and I saw that so many of the old homeopathic ophthalmologists were using galvanic therapy along with homeopathy as a, you know, kind of an adjunctive treatment. So I think they do work well together. Although, you know, microcurrent is not necessary. You know, if we could find the right remedy and treat the patient successfully, I think that's all that's needed. I'm kind of a purist. You know, I'm a classical homeopath, and sometimes I think that all you need is the right remedy. I really believe that. Unfortunately, it's difficult to get the right remedy. And a lot of times I think people just waste their time and effort looking at vitamins, nutrition, and IV. I mean, all those things can be helpful, but the best way to restore health is the right homeopathic remedy.
Ed, can you make a comment about the homeopathic eye drops and their removal from the market? And I know you recommend Ocumed eye drops. Actually, I brought a bottle. I've been using those. I find they're helpful. And I've had a few patients who use the Ocumed eye drops. One is seeing you for her macular degeneration, and she's had improvement.
Well, the Ocumed is not really a homeopathic. It's just a nutritional supplement. It has ascorbic acid and some precursors to glutathione. But in terms of my feeling about homeopathic eye drops, it's just the mechanism of delivery. I think the oral is no different than the eye drops. I think patients have maybe a certain placebo effect by taking the eye drops. They think that the homeopathic remedy is, you know, having a higher concentration in the eye. As homeopaths, we probably chuckle about that because whether you take it orally, olfaction, or whatever, the energy is getting into your body. Now, one eye drop that I love, and it's not homeopathic, is ozone eye drops. Ozone's a highly reactive form of oxygen, and when you bubble ozone into saline, it's just a wonderful eye drop for reducing irritation, redness, dryness, and there's really no preservatives or no petrochemicals in it. So it's a product that I recommend for my patients with dry eyes or some chronic eye irritation. Unfortunately, you have to make your own ozone eye drops. You buy an inexpensive bubbler. It's almost like an aquarium bubbler, and it bubbles ozone into saline, and it works extremely well, extremely well.
So the withdrawal from the market, the FDA had their action against their letters they sent to all the homeopathic eye manufacturers, the Similacin and all the other, and in fact, they're all off the market now. For you, that's not an issue.
It's not an issue. I don't think it's really, it's probably an issue for a lot of patients because they felt that those eye drops were, what they really needed. I actually had thought about, educating patients on making their own eye drops. You just buy a bottle, a 5 cc bottle of artificial tears, and maybe you put a small pellet or whatever remedy into that bottle, and you could make your own. But I think there's a certain risk involved because of contamination and an eye infection. But I think, unfortunately, we're going to be subject to more prosecution and persecution. And I think as homeopaths, we better learn to make our own remedies. We all may be forced to be making our own X potencies in our office and giving it to patients.
Dr. Kondrot, great talk. It was just awesome. It seems like there's just a plethora of people nowadays that are getting dry eyes. Like everybody I know is having to use just, saline eye drops for lubrication, etc. Is it environmental? Is it what's causing it all?
I think it has to do with suppression and just the whole energetic state of the body becoming dry. The dry eyes are more common after laser eye surgery. That a large number of people in the population have gotten LASIK or PRK or some type of refractive procedure to eliminate myopia. And there's definitely a correlation with dry eyes after those procedures. So a lot of it has to do with suppression.
Dr. Kondrot, what about reading some things about people using castor oil around their eye, like on the eyelashes, around the lid, supposedly they get relief from dry eye?
I don't recommend castor oil around the eye. I know that you hear a lot about treating cataracts. I investigated, Edgar Cayce was really big with castor oil, but in not one of his readings did he recommend using castor oil in the eye. He recommended castor oil packs on the liver. And of course, there's a connection between the liver and the eye in Chinese medicine. So I think it could have a beneficial effect, castor oil packs on the liver, but I don't recommend it in the eye. But as I mentioned, cataracts are probably the toughest condition that I treat. And I think it does have to do with nutrition. Dr. Levy, I can't think of his first name, wrote a book on vitamin C. He's a medical doctor and an attorney. And he feels that cataracts are a form of focal scurvy. As humans and guinea pigs, we can't make vitamin C. We're dependent on vitamin C in our diet. We have enough vitamin C to prevent scurvy, but we don't have enough to reduce some chronic problems like periodontal disease, heart disease. This is his statement. cataracts, macular degeneration, that it's a form of focal scurvy.
We have a question from Elizabeth Davis. She says, what is the best contact for the Facebook group? How do we get to your Facebook group?
Oh, just go to the Facebook page and go to, in a search engine, type homeopathic eye.
Homeopathic.
Yeah.
Okay.
Yeah, homeopathic eye. You'll come to the Facebook page and then just put your name in to request to become a member. It's primarily a group for eye professionals, but other people are more interested because, we're discussing cases from an optometric or an ophthalmic perspective. We're going to be using a lot of terms that a lay person may not become familiar with. But we have a great group of 6 eye doctors, and we present cases and discuss treatment, and we're trying to bring back the history of homeopathic ophthalmology. And it was really an amazing group of individuals that did so much for homeopathy. And unfortunately, it was lost.
I think Joel has another question, and we have a couple questions here. Joel.
Are ophthalmic migraines an eye problem?
It's more of a neurological problem. You're talking about there's a retinal migraine where all you do is have visual problems, and no headache. What are the symptoms? You're talking about a classic migraine or?
No pain, just the flashes or colors for the eye interfering with the vision.
Yeah, that is something that could benefit a patient with homeopathy. I don't know if that's more of an ocular problem or if it's more of a neurological, but certainly I see a lot of patients, they come to me with, those visual symptoms.
Thank you.
And we have another question, Elise?
I am with someone overseas that has, she's young and she's about to lose her eyesight. Is there any homeopath overseas in Europe that you might recommend or that you are familiar with?
What country is she in?
She's in Hungary.
Elise has a friend who's in Hungary who's losing her vision. She's wondering if there's someone you can recommend in Europe or in Hungary who uses microcurrent and or homeopathy.
I think there's someone in Turkey. There's a doctor. If you could email me, I'll try to get you the contact. There's a doctor in Turkey using microcurrent. And there's also a doctor in Rome that's using microcurrent. He's a retinal specialist. He's a good friend of mine in Rome.
I think that's it. Joel? Joel has another question.
For Drew said, would you use skin warts?
I'm sorry, Joe, I didn't hear the question.
The question was, if for drusen on the retina, would you use because there's nothing in the eye part repertory for that, would you use skin warts for drusen?
Yeah, because they are a type of wart. But then again, I wouldn't treat the drusen unless they had symptoms. My mother, when she was alive, had horrible drusen. In fact, I referred to a retinal specialist and he almost had a heart attack. He couldn't believe how bad her drusen were in the eye, but she had excellent vision until the day she died. So I think, if you have a pathology like that that's not causing any visual symptoms or there's no other associated symptoms to hang your hat on, you may not need any type of homeopathic treatment. But in other words, if they had, visual complaints and loss of vision and other symptoms, then I would use the rubric Sometimes I like to use the skin rubrics.
Yeah, final. Yeah,
You,
this is a PDF. The other one.
Let me see if there's any other questions online. Oh, there's just a comment here from Minaj. Our pure materia medica is always expanding. That was not thinkable 10 years ago. Was not thinkable 10 years ago is possible today. Yeah, I think homeopathy is getting kind of catching its stride nowadays in a lot of ways.
Yeah, people are becoming disillusioned with modern medicine. It's just, I think we're being manipulated by the pharmaceutical industry. And we're getting sicker and sicker. There has to be a better way, and homeopathy has that answer.
Absolutely. Well,
I have a
oh, go ahead.
question, Dr. Fuel, if you don't mind. Can Dr. Kondrot please again repeat the amber screen or the amber protection he was talking about for the computer light?
Oh, they're called blue blocking lenses.
Okay.
It's an amber lens, and you can buy them. You can just go into an optical shop and ask for blue blockers. They're very common. They reduce the blue spectrum of light. And those of us that are always on our computer at night, we should definitely have those, because blue light at night is very toxic to the eye.
Okay. Thank you, doctor.
Oh, thank you.
Yeah, one more question, please.
So how about some supplementation we recommend?
I'll tell you what, I'm not really big with supplements. I read an article that people that take a lot of supplements actually have a lower life expectancy. Maybe that's because they're sick to begin with. I don't know. But I believe that food is our best medicine. We are what we eat. I think we need to eat more, organic, fresh food without preservatives. There is a product that I do recommend. It's called Ocufolin. Ocufolin. It's a medical grade vitamin supplement. You need a prescription in order to use it, but it's probably one of the few products that I have seen to actually benefit patients with macular degeneration and glaucoma, Ocufolin. And the best thing about it is it's inexpensive. It's only like $49 for a month compared to a lot of these products that people are paying lots of money for. And you can just Google Ocufolin and you can go to their website. I like that product. It's a quality product because so many of our vitamins and nutritional products are not contaminated with lead and mercury. I used to buy a lot of products from Douglas Laboratories. In fact, at one time they manufactured some of my eye supplements. And then I got a bottle from them that had a little note at the bottom, may contain lead. I'm saying, my God, what am I doing? I'm selling these products to patients and they may contain lead.
Yeah, she's commenting that maybe they were bought out. I think that happens with a lot of the companies that are being bought. Their original manufacturing is good, and then they're bought out by a basically big pharma, and then they just go for money, increase the price and decrease the quality.
Yeah, that's the issue. Big pharma is buying a lot of these nutritional companies.
Yep.
They want to get rid of the competition, drive them into the ground. I think that it's really scary.
Thank you.
Ocufolin.
Yeah, Ocufolin.
And you recommend that now over the Ocumed?
No, Oclumed is an eye drop for cataracts. Oclumed.
Ah.
So Oclumed's an eye drop. Ocufolin is a pill.
Got it.
But I think the Oclamed is a great product. The other interesting thing is I think when you combine it with microcurrent kind of acts as a carrier to take the product deeper into the eye. When you do develop a cataract, they noted that the ascorbic acid levels and glutathione levels decrease in the aqueous. So it makes sense. You're taking an eye drop that has, vitamin C and glutathione precursors in it to help restore those levels, and the microcurrent can act as a carrier. I also recommend that my patients take, extra vitamin C, maybe 3 grams a day, if they can tolerate it, the vitamin C, to help. And whatever you do, if your eye doctor is talking you into having cataract surgery, don't do it unless you're really limited in your activity. I see so many patients that come to me with advanced macular degeneration, and the causative factor is I had cataract surgery 3 years ago. Why'd you get it done? Well, I wasn't having trouble with my vision, but my eye doctor said you had cataracts, you better get them taken out. So I had them taken out. Then they get macular. That's a common history so I think that cataract surgery can be suppressive.
Do you think it's that removing the cataract, it removes the protection of the UV hitting the iris?
I'm sorry, Tim?
Do you think it's that the removing the cataract, all of a sudden, the cataract is kind of protecting the retina and all of a sudden that's gone? Or you think it's like more homeopathic suppression?
Yep, I lost you.
So do you think is it more like a homeopathic suppression, or more just that when you remove the cataract, you're removing the protection that's offering the retina?
Well, that's one theory. You're removing the protection, but I think you're removing the pathology without treating the underlying cause. That's like saying if you have eczema and you put steroids on, well, you're pushing it deeper. The body is maintaining homeostasis by having this cataract, and you're removing it without looking at what the problem is, the imbalance in the body. But it could be, the increased exposure to ultraviolet light, or it could be the shock of the surgery, all these things. But my gut feeling is it has to do with suppression.
I think it's time for a round of applause for Dr. Kondrot.
Excellent lecture.
Thank you so much.
Thanks everybody. It was a real pleasure, and I look forward to working with all of you in the future. If you have any questions, as Bob said, I'm your go-to guy when it comes to eye problems.
There we go.